All right, guys, I'm going to do a head of bed walkthrough for those of you who may be in nursing school, never actually been in the clinical environment, so you can know what the head of the bed looks like. There's a bunch of bells and whistles, can be a little intimidating at first. So let's walk through it. I'm at a sim lab in Rockford, Illinois. Skills on point. Thank you so much for letting us use your sim lab. So here's head of bed, okay? These are the typical things you'll run into. Okay, so first I want to talk about suction, okay? So the suction head can look like this. Or here's another example of how suction heads look. So something I want you to notice, we've got this here, this tubing is connected here, and then this tubing connects to this canister. Okay, see where it says vacuum. Okay, so here is where you would adjust it. So if someone has intermittent suction ordered or continuous, and then obviously off, then like low, medium, high, and you would adjust for what it needed to be per order using this, okay? Then we have up here, so the vacuum connects to the vacuum, which is what creates the suction. This is what goes to the patient. Okay, so here I have suction tubing that I have hooked up, and it goes to my patient with this, okay? And then this is like a yanker, whatever you call it. And then this is what you put in their mouth to suck out secretions, okay? The canister, just comes out like that, okay? And you can also pull this whole thing off. It just slides back on. But what's important for suction to be maintained is that all of these things are covered or like the caps are on. So you will see that I have this hooked up to my patient, this hooked up to the vacuum. This one is covered up. Now what you'd use this one for is when the canister is full of secretions, you pour something through here to solidify it so you can throw it away. Then it's labeled ortho. I don't know. I've been a nurse 10 years, never used it. Then this is your flow meter for your oxygen, okay? So again, this doesn't work because we're, in sim, but there's a little bulby guy here that when you turn it and you just put it to wherever you need it. It may have this, which is called a Christmas tree adapter, which you need to sometimes use to adapt, to put different oxygen devices on here. But this nasal cannula just connects directly to it. You can see that it just screws right on. And then we can trace that all the way to my lovely dummy here and then into this nasal cannula. Finally, we've got these here. We've got, these are obviously regular electrical outlets. The red just essentially means whenever there's a power outage, power will still work here. So you want to naturally connect your more important things to these outlets. There's also the medical air one. I don't know. That's another one I've never used. Make sure you follow for more nurse tips.